All right, in this video, we're going to be talking about urinary tract infections, or otherwise known as UTI, and pyelonephritis, which is a kidney infection. So what is a urinary tract infection? Well, this is an infection that's found within the urinary system. And this is typically caused by bacteria, which is the most common type. Specifically E. coli as a bacteria. It can also be caused by viral or funguses as well. And further into this video, we'll talk about some of those antibiotics and medications that will treat bacteria and a fungal infection as well. So we know that you can have a urinary tract infection any part of that urinary system. So this could affect the kidneys, the ureters, bladder, and urethra. So the infection of the bladder would be called cystitis, and infection of the ureter would be urethritis, and infection of the urethra would be urethritis. And then when it gets into a little bit more complicated infection, that's when the infection spreads to the kidneys, and that's called pyelonephritis. So a UTI typically starts within the lower tract. And when we're talking about that lower tract, we're talking about that urethra and bladder area, okay? So that's where that's typically going to start, and then if it progresses, it's going to work its way upward. So a lot of causes, or some common causes, could be if you're a woman, the most common cause in women is because of the shorter urethra. So that's going to enter through that urethra, and then it's going to start migrating and traveling up through that bladder. If we don't catch it, then that's when it can start traveling up the ureters to the kidneys. The upper part of the urinary system we talked about were those ureters, and then obviously the kidneys. So if that urinary tract infection travels up those ureters, now we're getting more into that upper urinary system. That's more serious, it's more complicated, and now it's going to be traveling directly to the kidneys, and that is called pyelonephritis. That's not good. When this happens, this can spread to the heart through the circulation, and then you end up getting septic shock, and then the person is at risk potentially for death. So we talked about how UTIs do tend to affect women more because of the female anatomy. We know that the urethra is shorter, and just because of the proximity to the rectum and the urethra, it makes it harboring grounds, shall you say, especially if that person is not wiping properly. So we should always be instructing the patients to be wiping front to back. In males, they have, well, we'll get to males here in a second. Let's stay on the women track right now. So also for women, wearing tight underwear, we want to try to avoid the use of thong underwear, that really nice meshy satin underwear that you can get from this fancy clothing stores. We just want good old-fashioned cotton underwear so it's breathable. So the defense system of this infection and how the urine actually flows, and it makes it a lot more sense to understand what is happening here. So how does this urine drain? What is this defense system? So urine drains downward to prevent urine from backflowing into the kidneys, right? So the uteral vesicular valves, the muscles of the bladder, and the pressure created by the urine. So its urine itself is sterile and has antiseptic properties that actually prevent germs from sticking to the bladder wall, which is pretty cool. So the pH of urine is typically acidic, and it has a higher urea concentration, and this helps flush out those germs as well. With people that have diabetes, mellitus specifically, that urine kind of changes because there's glucose in the urine. And so people that are diabetic are also at a risk for diabetes, and we'll get into some of those more, some more of those causes too. But here's another one. So we know women, and then now diabetics, because of that glucose, it makes a really good environment for that bacteria to grow. Because what is glucose? Glucose is sugar, and bacteria loves sugar, so it's going to grow in that environment. Okay, so now we're going to talk about more of those guys. So the prostate gland in men secretes an antimicrobial type of fluid that actually helps coat the urethra, and that ends up killing any bacteria that would come into contact. So if you think about that, if there is a man that has a prostate issue like BPH that we talked about a couple weeks ago, you would not have this antimicrobial fluid. Why? Well, because we know with BPH, that prostate is so big and so swollen that it is constricting that urine flow from coming out. So that is not going to help secrete that urine. They're already not producing hardly any anyways. So that is not, this antimicrobial fluid is not going to be produced with people that have an issue with their prostate gland like BPH. And then back to women, women's normal flora of the vagina has lactobacilli, and this actually keeps the environment acidic as well. And this helps prevent the bacteria from entering the urethra. And it can also help fight that bacteria if it does come in contact. And one of the other things that's really cool about this lactobacilli is that you might have even heard of the probiotic Acidophilus or lactobacillus. Those are probiotics that give you those healthy fighting organisms and those healthy bacteria that's putting that inside of your body to help this as well if you're not producing enough. So now let's go into some of the causes. So we talked about a few of them, and we can just review those real quickly. More common in women, like we said, because it's the shorter urethra, and the urethra is close to the rectum, right? And especially with improper wiping, if they're wiping back to front, they're introducing that possible E. coli and other organisms into that urethra. We talked about diabetes, especially with the diabetes mellitus, because of the glucose in the urine. Overuse of antibiotics. A lot of times when people are on antibiotics, we like them to take a probiotic as well. And this actually is done to help prevent those urinary tract infections from happening, or help them from coming again if they're taking antibiotics for a different reason. Indwelling catheters, that is one of the number one reasons that people get urinary tract infections, is because of Foley catheters. This is a harboring ground for bacteria to form. That's why Foley catheter care is very important. Instructing others, whether it's the techs on the floor, or if it is other nurses in long-term cares, into how to properly be able to do this, and teaching the patient to not be touching that area with their hands, always making sure that everybody is using gloves and we're using good sterile technique when we are cleaning those areas. Hormone changes play a huge role, especially like pregnancy, menopause, even birth control can change that normal flora. Toiletries, like excessive bubble baths, powders, any type of perfumes, or scented tampons. These are all risks and causes that can cause a urinary tract infection. Especially a lot of times women think that, their blood might smell, and they want to smell pretty. And so they're wanting to use those scented tampons. I don't know so much about scented tampons, but I know that there are scented pads, menstrual pads, and then also using some type of, like douchings and powders and perfumes to kind of make them feel like they're cleanly and they don't stink. But unfortunately, this is a huge, huge risk factor and a cause to get a urinary tract infection. Also, vesical rectal reflux, or better known as VUR. This is a congenital defect in pediatric patients in that population. This is actually a valve defect that causes the urine to backflow from the bladder to the kidney. And then the normal one that happens a lot of times is, and this is completely unintentionally, is that over-distended bladder or overextended bladder. And this is just because the bladder has not been emptied on a regular basis. Especially for the people that are at risk for that is nurses. It's kind of called nurse bladder. We feel like we need to go and do this and that, and we just don't want to take the time to go to the bathroom because it's just kind of gonna mess up our plans and how we want to do things. Or maybe we're in a tight spot, we have to chart, and we don't want to lose our place, and we just need to finish up. We kind of need to get out of the habit of that and making sure that we are taking care of ourselves, because our patients can't be taken care of, right, if we don't take care of ourselves first. Other people that are at risk for this overextended bladder would be ones that are immobile. So think of, or people that are weak. So think of people that are in a nursing home. Maybe they are self-conscious and they do not want to urinate in the bed. And, they want to make sure that they are continent, and they don't want to have an incontinent episode for fear that, something, is going to happen, like having to get a catheter or having to be, like on some type of bowel regimen plan. And these people end up holding their bladder, trying to, help the staff out because they don't want them to have to do a total bed change, and all of that. So those people are at risk too, especially because in a nursing home, there's typically a lot of more patients or residents to take care of. So your time is limited with each resident you're taking care of, as well as answering call lights. So maybe you're not able to get to the call light, soon enough, and this, poor Mr. Johnson, is trying to hold his bladder as much as possible, and he doesn't want you to have to do a bed change, or and this is that can be a huge risk factor as well. Then the risk for another cause could be after sex or after intercourse. We need to try to void afterwards to help wash out anything else that could have made its way by that urethral area. And then avoid any spermicidal lubricants, as this can be a harboring ground as well. Invasive procedures can also be a risk factor. Okay, so some of the signs and symptoms. Would be, Another risk factor, would be a decreased immune system. So this would be people that are at risk that would develop more of like that viral and fungal organisms of that urinary tract. So just anybody that's at a decreased immune system has that risk of developing that kind rather than the typical common bacterial. Okay, so some signs and symptoms we'll talk about now is smelly urine. So smelly urine is more of that odorous urine. It's going to appear dark and it's going to appear cloudy. Also are going to have pain when voiding. So this pain is typically felt as a burning feeling, and that's typically on or while trying to urinate. Also, the persistent need to void. You're either can't void or you're only able to get out a little bit. So that can be either. You can either have, you feel like you have to go, that urgency, and then sometimes you only feel like you can get a little out, but you still have that urgency to go. And then you can have, you can also have incontinence, like we talked about with elderly. You see that more in elderly with incontinence for sure. And let's see what else. Fever and chills, you can, even though that is more seen with pyelonephritis, but you can have that more with a fever. I wouldn't say more chills, but, and then just regular headache, malnese. You can always have some nausea and vomiting, of course. And so I think that is it for the signs and symptoms. And then we'll talk about education. So these patients are going to be on antibiotics, right? Because we need to treat the cause of the bacteria. So education will be to take the entire prescribed amount of antibiotics, that whole course. And so by them taking that whole course, that's going to minimize the risk of antibiotic resistance, which is going to cause more issues if they do become resistant to that antibiotic. We'll talk about here in a few minutes about how to get a sterile specimen via midstream specimen, urine specimen, and how and why a culture sensitivity is so important because of that too, to narrow that down on the type of antibiotic. Of course, education again, to making sure that these patients are instructed to make sure that they are wiping from front to back. We said avoiding after intercourse, and then also avoiding caffeine and alcohol. Caffeine would be coffee, tea, even chocolate. Trying to void frequently. So we know to have proper urine flow, we need to try to have at least 30 mLs of urine an hour, right? So they need to try to void frequently, loss of fluids to help flush that out as well. They need to try to avoid bubble baths, perfumes, and sprays, like we said about some of those causes, and then wear night or non-tight cotton underwear. Okay, so to increase the fluids, we want to do a calculation that takes their weight in pounds divided by 2. And so this is going to calculate the total ounces needed, the total ounces of fluids needed for that day. So let's do an example problem. So an example problem would be a gentleman that has a urinary tract infection, and we're needing to figure out how many ounces of water they need to increase daily within their antibiotic regimen. So you're going to weigh them, and they weigh 240 pounds. Okay, so we're going to take 240 pounds and we're going to divide that by 2, and that calculates out to 120 ounces a day. So we're going to instruct this gentleman that while they are on this antibiotic course, to not only finish this, but every day we want you to drink 120 ounces. And sometimes, especially at the hospital, they can go home with a little, or a large, I'm sorry, not a little, a large thermal cup. And sometimes those are labeled, but we also can maybe write with like a Sharpie on that amount, or we can also try to get him a special type of cup, or tell him that he needs to fill this up, maybe 2 or 3 times, depending on that size, to make sure that that is adequate amount of ounces that he needs. Another type of food that we want to instruct our clients to avoid would be spicy foods, and then also anything that's like vinegary. A good part of education for all aspects is to have them teach us back what we've just explained. And this also helps prevent that reoccurrence, that we know that we have instructed them, but let's hear and make sure that they listened and that they're going to be able to understand what we had said by verbalizing back to us, so we know that they understand. So that way, if something happens, that's on them for the fact that we did explain. But here we are again, we're going to have to treat this again, but at least we've tried. Okay, so now let's talk about how it is diagnosed. So how is this diagnosed? So we're going to do a urine culture. This assesses the bladder for that urine. So they can either do a midstream collection if they're able to urinate into a sterile container. So what they're going to do for a woman is you're going to have some antiseptic wipes, and you're going to have 3 different antiseptic wipes. So you're going to instruct the woman, or if you need to do this for her, you're going to take 1 wipe and swab up to down, or front to back towards the anus, right on that labial fold on the left, 1 swipe down on the right labial fold, straight down, and then right in the center, all 3 different wipes, okay? And then you're going to instruct this patient to start urinating. Once they have a good stream, you're going to swipe that sterile cup in front of that stream and fill that up to the correct amount. And then you have had that sterile cup facing upwards, so that rim of the cap is facing upwards, not touching the surface of anything. You're going to carefully connect that and put your initials, the date, all of that on the label on the jar, not the cap itself. And then you can send that off to get cultured. On a man, you're going to use the same technique for the 3 wipes, but they are going to do in a circular motion around the urethra, 3 times each with a different wipe. And then the same technique for that midstream. If they're not able to urinate, we can instill a Foley catheter, if they're not able to, we can do a straight catheter and get that specimen that way. And if they have a Foley catheter already and that's not instructed to be taken out, we can withdraw some of that urine from that. So we use the access port on the Foley catheter. We never want to use that collection bag. that collection bag could be contaminated because that urine has been sitting for a long time maybe in that bag. Also, that bag is typically not changed out, every day. I mean, we don't change those out every day. So that is not a sterile environment, and that's not, it's more of a harboring ground. Who knows what's in there or growing on that bag from days after it's been drained out, every once a shift. So on that catheter, on that Foley catheter, you're going to use the access port. So on that access port, you can actually withdraw some of that urine with a syringe, and then you can just syringe that into that sterile specimen cup for the culture and sensitivity. So we talked a little bit about how these patients with a bacterial infection are going to need to get an antibiotic, right? So we always want to do these cultures and collect this urine always before we initiate any type of antibiotics. After that urine specimen has been sent for culture and sensitivity, the doctor will start these patients on a broad spectrum type of antibiotics. And then that antibiotic will end up changing once that culture and sensitivity is through to more of a narrowed down amount of antibiotics that will actually treat that direct microorganism that is affecting the infection. Let's see. So we talked about education. Let's see what else. Like we talked about with that Foley catheter, the doctor might order you to remove that catheter. They might not. It just depends on what they're going to want to do. We do want to encourage at least 2 to 3 liters of fluid per day. And then also, of course, that can be also calculated as well because this is going to help flush that urinary system. We want that urinary system nice and diluted. Okay, so some nursing considerations. So we said to 2 to 3 liters per day to help flush out that urinary tract. Also, the doctor might want us to remove that Foley catheter. And then we talked about how we want to do that urine culture before giving any type of broad spectrum antibiotics. These patients also may need some analgesics to help control the pain, and we'll also talk about some of those medications as well. Another sign that some elderly patients might have that is not typical symptoms of a typical urinary tract infection is confusion and lethargy. So a lot of times these patients can get elderly patients. You see this a lot in the nursing homes. Again, Mr. Johnson, he's typically a real nice guy. He's very cooperative. He knows the drill and what he does, on a day-to-day basis. But, he woke up this morning and all of a sudden he's like this different person. He doesn't really know where he is. He's cranky. He's agitated. But he doesn't have a fever. He doesn't seem like he's sick. Everything seems okay. And this is a huge symptom for urinary tract infection in those elderly adults. So for elderly, they are typically asymptomatic regarding that confusion and just that new onset agitation and lethargy. And they may also have some new incontinent episodes. If they're typically a continent person, they could have some incontinent episodes. Okay, so we will talk about some of these medications now. So So some of the simple things that we can do before we talk about medications is that we can instruct these patients to drink cranberry juice. That is going to help create a good environment for that bacteria to stop migrating. And let's see what else. All right, so we'll talk about the antibiotics now. So Bactrim is a sulfamazide antibiotic. So we want to instruct, because this is a sulfa, we want to instruct our patients or look at their allergies for any type of sulfa reactions that they may have had in the past if they've been on Bactrim before. And this can also be called that TMP SMZ or TMP SMX, that trimethoprim sulfamethoxazole, and that's the Bactrim, okay? And if the urine is concentrated, then they can develop crystalluria, which is kind of crystals in the urine. So that's why we need to instruct that they make sure that they drink lots of fluids every day, and then the same time every day to maintain consistent blood levels, and then of course making sure that they fulfill that whole course of antibiotics. Also, macrodilantin macrobid is that nitrofurantoin. One of the things that we want to look out for this is monitoring their creatinine level, because these can affect those kidneys. So we want to be monitoring that as well. Here. Fluconazole, so this is a fungal medication, also called diflucan. This is going to kill those yeast infections. There is also pyridium, which is that phenazolpyridine, and that is going to turn your urine orange. So we need to instruct those patients to not, get excited and get worried when they urinate in the toilet and they see, not clear yellow urine. It's going to be orange with pyridium. And kind of an interesting way to look at this is that this pyridium, it brings that fire down. So this is given, it's an analgesic property, and this is to help minimize the pain with that burning urination feeling. They can also take over-the-counter a medication called Azo, especially if they can buy this, like I said, over-the-counter if they suspect and they don't have a chance yet to get to, a prompt care or their doctor. They can take this. It will not cure the urinary tract infection, but it will help reduce some of that bacteria. They need to, during this antibiotic courses, they need to probably maintain more of like a bland diet, of course, staying away from those types of foods, making sure that they are understanding how to properly wipe front to back if they have a knowledge defect. Also, like we talked about, that teach back for that. And let's see what else. Let's go back to the culture. So on the culture, we're going to be seeing high levels of white blood cells on that UA. it's common to actually see some blood in there too, and also the type of the type of the bacteria will be labeled on there as well. Also, if there's like any type of like sediment or mucus, that will be said as well. And let's see if I have anything else. I think that's it. So we'll talk about pyelonephritis now. So we talked about how pyelonephritis is in that upper urinary tract, and that is the infection of the kidneys. So we know that if somebody gets pyelonephritis, that's from a urinary tract infection, typically in that lower tract, that was either left untreated or was not treated properly. So this can happen if somebody is not taking that full antibiotic regimen, right? So they stop taking their antibiotic, they feel fine. What happens? So that bacteria has not been all killed. It's just been killed enough that they're not as symptomatic, or maybe they're not symptomatic anymore, but they still have, 5 days left on this antibiotic. But, I feel fine. I'm going to save it, maybe save it for the next time, or save it for a family member. And we have to instruct our clients that they cannot do that. And then that can also be a risk factor for developing this pyelonephritis, this infection of the kidneys. This is where we think of more of that complicated type of antibiotic, or that more of that complicated UTI, because that UTI in the bladder has now gone up those ureters to the kidneys. So the hallmark sign for this is going to be that costovertebral tenderness. This is going to be that also could also be called that costovertebral angle, or that CVA tenderness. So you're going to find that 12th rib, and then that hand over, and then put your hand over on that bottom of that 12th rib, and then make a fist with your other, and then just give your other hand a little bump on top of your hand on that person. And then if that causes any type of pain or tenderness to that patient, that might be indicative of pyelonephritis. They're also going to have that dull flank pain or back pain, but it's always going to be dull. It's never going to be excruciating. That is not an indicator of pyelonephritis. That could be, maybe something else related to, but pyelonephritis is dull flank pain or back pain. This is where you're going to get more of that fever and chills, okay? So this is bad. This is worse than that lower tract urinary infection. You're going to have vomiting, nausea. You may even have some tachycardia, tachypnea, and also some hypertension as well. And then definitely, again, with that geriatric population, they could have that sudden confusion as well with this, which is going to increase their risk for falls. But they're probably most likely not going to have that fever like we talked about. The same type of culturing that we would for an uncomplicated urinary tract infection. We're going to see those white blood cells. We're going to see an increase in creatinine, because now we're messing with the kidneys, right? That creatinine is going to go up. So we're going to expect that to be over 1.2, 1.3, right? And then that BUN is going to be elevated. So we're going to expect that to be, 20, if not more. And then also we're going to see nitrates. And then those will end up, all of that will be cultured, and we'll find the right antibiotic for that. So some of those antibiotics are going to be probably a little bit stronger. We'll probably be looking more into maybe IV antibiotics for that complicated, because we need to get that under control fast, so we're not damaging those kidneys, because this is a huge risk factor for acute kidney injury. Anytime those kidneys are being messed with, or any other type of stress, that's a risk for acute kidney injury. And we don't want to have to send our patients into, needing to get dialyzed, or prevent them from having any type of chronic kidney injury as well, or disease. So typical antibiotics would be like vancomycin or Zosyn. For Zosyn, that is a penicillin, so we want to be making sure that we have checked the charts for any penicillin allergies before we administer the Zosyn. And then vancomycin can kind of cause that flushing feeling, and also better known as red man syndrome, and that is something that we need to look out for as well. And like I said, those are typically given IV. Of course, they would be getting sodium chloride hung by secondary as well, with these antibiotics, because we need fluids being perfused through as well. So I think that is it for this talk about urinary tract infections and pyelonephritis.